All right, good morning and welcome everybody to the Health Transformation webinar. This is your host, Cade Archibald, and we also got our amazing teacher, the founder of East West Health, Reagan Archibald. Reagan, how you doing?
Yeah, hey everybody.
So today we are going to be talking about long-term resolutions and solutions for back pain. And so going through a lot of cool studies and some really cool content today. Reagan, I'm really excited to learn about solutions for back pain.
Great. Well, let's take you through it. So how many of you right now would say you've experienced back pain? I think, Kate, you've had back pain. What's the worst back pain you've ever had?
Probably my motorcycle wreck when a bike landed on top of, I cracked, let's see, it was like T7.
Yep.
Yeah.
That was the one.
Pretty painful.
Not a fun experience. And so I think everyone on this webinar, whoever watches this, is going to realize that at some point in their life, over 90% of Americans will experience back pain at some point in their life. And this is not just like my back sore because I lifted something. It's actually pain where you've damaged your back. And I mentioned in the last webinar, I think pain is the most expensive thing that we can walk around with, because when we have pain, the problem is not the pain itself, but it's what it does to our brain and what it does to our life. And so today we're going to talk about, areas where we get the most pain, and also as we age, where things start to break down. Because as we age, what happens is 65% of elderly patients experience osteoarthritic neck and back pain. So arthritis starts to set in. And this arthritis can be a byproduct of degenerative disc disease. It can also be a byproduct of too much just inflammation, where the arthritis is finally at that articulation, it's worn out. You can get 15 to 25% of elderly patients will get chronic joint pain. That can be in the ankles and the wrists, the knees. 35% will get peripheral neuropathic pain. That can be due to diabetes or post-therapeutic neuralgia. And then 40% will have musculoskeletal pain. And so that can just be, tendons. That's where you can have hip muscle pain, leg pain, just, areas of pain throughout the body. So as we age, one of the most important things that we can do is make sure that we keep our bodies loose, we keep it flexible, and make sure that you're actually keeping those discs hydrated. So right now, all of you, if you just, maybe some of you are on the West Coast, for most of you are on Mountain Standard Time, some of you are on the East Coast time. So what I'd recommend you do is make sure as you're listening to this webinar, we'll plug in any comments or questions that you've got about back pain specifically. But what would be also very important is grab a glass of water, put a pinch of Himalayan sea salt in that water, and get yourself hydrated. And then make sure that you're moving around. When you're sitting too long, you pinch off this big old artery that's right in your pelvic region called your femoral artery. And then you lose blood supply to the legs. You don't get as oxygenated. And many of you have seen, that whole syndrome where when people sit too long, they end up losing mass in their butt. So a lot of office workers, and then they lose mass in their hamstrings. And so their whole posterior chain, muscular chain, gets underdeveloped, and that can be a major contributing factor for back pain. But if you look at the discs in your back, they're kind of like jelly-filled donuts. And as you go on throughout the day, that jelly just gets squeezed right out of your back. And then you go to sleep at night, your back gets hydrated, and it allows for those discs to get fluffy again. So if you're ever trying to win the competition for the world's tallest person, the best time to get measured is first thing in the morning when you wake up. that's the ideal, because your spine will be hydrated at that point. So look at that, see what you can do. All right, so those are kind of two big takeaways. Don't sit for more than 20 minutes at a time. When you do get up, move around, keep your back mobile, flexible, fluid, and then always stay hydrated. So the more hydrated you are in your body, your organs are going to take all of the hydration first. They're going to take the water and just suck it up, because that's more important. You can live with, if your back is, if you have your vertebrae are all collapsed and you have a complete loss of fluid or synovial fluid in those discs, you can still survive, but you can't survive without a heart or without a brain or without a liver. So there's priorities that happen with hydration, but the better you stay hydrated, the better your joints are going to do. So, all right, here's something interesting, a study that I found. And this is where they took, I believe it was 2,000 subjects. And what they found with these subjects is they wanted to see what percentage of patients would have abnormal findings on a lumbar spine MRI and CAT scan images in healthy, pain-free subjects. So this is very interesting, because these people had no symptoms. And what they found is that when we're in our 20s, that even these healthy 20-year-olds, there's still about 5% that had spondylolisthesis. There's another in that same group, about 3% had spondylolisthesis. And this is where your spine, it starts to create, it's an abnormality in the function of the spine. So you have a different change in the bony structure in your lower back. And that can cause massive problems in the future. Facet degeneration. So the facet joint is where your spine moves from. So it's near the outer part of your spine. A lot of nerves cruise right through that facet joint. Disc protrusion in the 20s, about 29% of 20-year-olds had disc protrusions. And then about 30% had disc bulges, and 38% had disc degeneration. And this is in their 20s. Once again, they have no pain. And so I look at this and I say, look, symptoms are the very last thing to show up in our bodies. And it becomes very important for us to keep our spines nice and loose, but also keep the structural integrity there. So it's not too loose, but it's also, you're not rigid. There's an interesting quote in the Chinese medical text called not the Tao Te Ching, but the Yellow Emperor's Classic, the Neijing. And what it says is, it talks about a tree, and it says, the trees that are hard and brittle are the ones that break. They're hollow in the inside. And that's what a lot of these studies are showing, is that we think we're healthy when maybe we're not quite as healthy as we'd like to be. So for those of you who have had back pain, what would you say the worst thing is about having back pain? And feel free to plug it in the chat box if you'd like to share. But
yeah, I just know when I had my back pain, the worst was just like thought process. Like, it's like you can't really think clearly. So painful. So yeah, it's tough to get anything done.
Yep. Yeah, and that's what, in working with thousands of patients with back pain, there's an interesting study that was released by the Journal of Pain Management. And what they did is they looked at all of the modalities for back pain. Now this was published, it's almost been 10 years now. I believe it was about 2008, 2009. And they looked at physical therapy for back pain. They looked at chiropractic care for back pain, steroidal injections, the cortisone injections. They looked at acupuncture. They looked at massage therapy. They looked at NSAIDs and gabapentin, and just treating it with all the conventional or all the non-conventional and conventional therapies. And acupuncture actually was the most impactful thing on back pain. And so all throughout my career, I've had very good success with back pain. But what I find is when someone gets into their 40s, which you can see in the 40s, how much more degeneration is occurring. So most of the time, remember, we don't experience symptoms until we have about a 60% loss of function in the body. So usually it's not until we're in our 40s that some of these abnormalities may start to show up. But even in these people, they still had healthy spines. They didn't necessarily have symptoms that went along with it, which is pretty phenomenal. But I noticed with acupuncture, yes, we get amazing results. But when patients got a little older and that degeneration got more set in, then that's where we started using regenerative therapy like stem cells. And stem cells have been a massive breakthrough at East West Health for our patients who've had chronic back pain. And I'll share with you guys some of the studies and share with you how stem cells work. But if you look at it in the 40s, almost 68% of people, of these healthy subjects, had disc degeneration. 50% had disc bulges, 33% had disc protrusions, 28% had facet degeneration, and 8% had spondylolisthesis. We get into our 60s, and this is where it gets a little disturbing because it's 88% of healthy people have, in this study, had disc degeneration. And so what disc degeneration is this is when the arthritis and the degeneration happens because the disc starts to collapse in the back, and then you start to get a disease in the spine. And so I think this is something that a lot of us, we don't realize that we have it. Degenerative disc disease, if you look at it, it is something that a lot of us, we can see it in an X-ray image. DDD is kind of the acronym for it, but it can be caused by minor injuries. It can be caused by when you jump off something and you don't quite have your knees flexed, that can put a huge amount of pressure on your discs. And so this is when the water, the hydration in the discs gradually leak out. So as the discs weaken, then they lose water and then they begin to collapse, and the result can be a pressure on the nerves and in the spinal column, and this can cause pain and weakness and numbness, but it's not always symptomatic, as you can see in these patients. But just the fact that they've lost that much hydration, where in 88% of the people, that means they're not taking care of their spine. So one thing I like to do every day is I like to grab something and just hang from it. It can be a pull-up bar, it can be the casing on your door frame, but something, and just hang there and let your disc rehydrate itself. Because by the time we're in our 80s, and I don't know how many of you on this webinar are in your 80s, but by the time you're in your 80s, it's over 95%. It's about 96% of 80-year-olds in this study who had healthy spines, no symptoms anyways. They had over 95% of them had disc degeneration. If you look at disc bulges, and once again, if you have disc degeneration where the spine starts to collapse because of the hydration that's leaking out of that disc, the disc bulge is over 80%. It's about 83%. In their 80s, disc protrusion was about 42%. Facet degeneration was, once again, it was up there at about 82%. And then spondylolisthesis was 50%. And spondylolisthesis is when that gets very severe. Then that abnormal pattern in the spine is basically where your L5, S1, right where your lumbar spine or your sacrum meet with spondylolisthesis, that's where you create a little shelf in your spine. And it can create a lot of tension and pressure on the nerves in the area. So I bring this study up for all of you so you can start looking at what can you do to keep your spine as healthy as possible. Because would you be concerned if you had degenerative disc disease? I think that's a massive concern of mine is, wow, I do not want disc degeneration. That's what I had in my cervical spine. I had a mountain biking accident, and in my cervical spine, that's where I had massive amounts of pressure. And when I had an image on it, it looked like I had a compression fracture. And then also I had disc degeneration above it and below it. And so it limited my range of motion. It was hard for me to try to surf. If ever I was surfing, your head's tilted back and my muscles would go into spasms. And so it limited me. And then we did stem cells on my neck. And now my neck, I have no pain. I can sleep much better at night. and I'm actually able to surf. I just can't get up on the waves very well. It's not my number one sport. Fun, but now I can do it without muscle spasms anyway. So here's another study. Very interesting. Chronic pain changes brain function and chemistry. So if you look at the gray matter in the brain, gray matter kind of indicates the health of our overall brain. And if you look at what happens when we have chronic low back pain, it actually atrophies. And our gray matter, it's the darker tissue in the brain, and it's mainly consists of nerve cell bodies and branching dendrites. So, if you guys can you guys see my slides okay?
Could you zoom in a little bit?
Zoom.
Or do it, set it up in slide presentation mode.
Okay, let me.
You just go to the far right, top right corner.
Okay, sorry about that, guys. Let's see. I've got to, let me stop sharing real quick. Exit. Okay, try that. And try that.
Perfect.
Okay.
All
Is
right.
that better?
Now
Okay.
everyone can see a lot better.
All right, sorry guys. So everyone saw this. Maybe not. All right, so we're getting into the goods now. All right, so the gray matter is where you get a lot of nerve cells. You have these branching dendrites that come in, and what those dendrites do is that's what helps lay down the synapses for new thought processes. It helps orchestrate events in your brain where you can be creative and thoughtful and experience emotion. And so if the gray matter is healthy, then you're going to have a pretty darn healthy brain. And so I think if you look at it, then if your gray matter starts to diminish, then what happens is your brain's just not as fluid. It's not as elastic. It doesn't work as well. And so in this MRI, what they found is that people who have chronic back pain, it impacts mostly the cortex and the thalamus, which can affect your immune system, but it can also affect your motor function, and it can cause some depression. And so what they found is that the gray matter atrophy caused by chronic back pain is 5 to 11% per year compared to a 0.5% in a normal aging process. So most of us, we're going to lose gray matter. It's going to atrophy. It's going to go away very slowly, 0.5% in the normal aging process. But if you have chronic low back pain, it's 5 to 11% per year. And so low back pain does not help the brain. Chronic back pain atrophy is equivalent to 10 to 20 years of aging. So it's not a great thing to have. So one of the things that we look at is, well, how can we help heal the back? Because the New Yorker, it's an online magazine, New Yorker, what they did is they took 3,000 patients or 3,000 people who had spinal surgery, and they asked out of this 3,000 people, how many of them actually needed additional surgery? And what they found is that 72% of the people who had surgery needed further surgery. So we know that surgery is the number one cause of surgery, but with spinal issues, it's very dicey if you start cutting into your back. And as many of you know that, when our patients who have come who've had chronic back pain, sometimes they become lifetime patients because their back has gotten so degenerated. You can see even in healthy people, a large percentage of quote unquote healthy spines, meaning patients did not have symptoms, they still had unhealthy disease patterns going on underneath it all. And that's what happens with diabetics. This is what happens with cancer. We have all these symptoms that go on underneath the surface, and there are all these imbalances and malfunctions and disease patterns, but then we don't do anything about it until they become symptomatic. So we wait too long to actually get our bodies healthy. And if you wait too long, then what happens is that's when you need surgery. That's when you have no other choice. And even if you have the 10% chance that the surgery might help you, you'll jump on that because at least it's a chance to get out of the pain. And so one of the things we've started looking at about 7 years ago, many of you know, you've heard my story. I was in a snowboarding accident and I collided with the skier. And what I did is I ended up needing to either have my shoulder replaced or do something different. And so what I decided to do was stem cell therapy. And with the stem cell therapy, I was able to regrow that rotator cuff, all the tissue there. The cartilage was regrown, and it changed my life. And so then we started looking at it, well, could this help our patients who have chronic low back pain? And sure enough, we found that stem cells is something that we've had phenomenal results with. There's a couple studies that I reference, and you can find these on PubMed. But one of the studies they found, in as far as patients who had spinal cord injuries, they found that over 80% of these patients who had spinal cord injuries had some type of improvement using umbilical cord stem cells. And so that's the type of stem cells that we're using. Yes, we've treated patients with multiple issues in their spines, but one of the things that the stem cells can do once they're introduced into a damaged tissue. So imagine that you've got, I'm not sure what your conditions are, but if you've got degenerative disc disease or disc bulge or facet joint arthritis, whatever is going on in your spine, when you put new cells and new tissue into that damaged area, it brings new life to those cells because it's like the vibration. The cells send out signaling factors. And so very first thing these MSCs do is they reduce the T lymphocyte activation. So they calm down inflammation that way. They reduce macrophage infiltration and microglia activation. So once again, that's how they turn off inflammation. If you have nerve damage, like if you had sciatica, or if you have compression on those nerves, then what happens is you have an increased neural growth and differentiation. Apoptosis, so it reduces the cell death. So the beautiful thing about these stem cells and these medicinal signaling cells is they send out these factors, these nice signaling factors, and they stop the cell death around that area. And then not only that, but they wake up all the other cells that are dormant. So it's like this nice awakening process that occurs where your body can go into a massive regenerative mode. They send out tropic factors. So these are secretions of neurotropic and angiogenic factors. So they help with blood supply and nerve supply is what tropic factors mean. They help with synaptogenesis. So they increase the connections. They help with myelination. So this is the insulation on your nerves. And then they improve angiogenesis. So they can help with the blood flow. They increase reactive astrocytes and proliferation and activation. So you get better signaling to your brain. But one of the things that we see with inflammation is inflammation can set into your spine, and it can be one of those areas that's really hard to get out because it is a complex set of interactions. It can be among pathogens and the immune system. But one of the areas that stem cells are attracted to is this inflammatory pattern, and there's certain molecules that get released when we have this chronic inflammation that's set in, and part of these signaling factors are chemokines, and that's where our body is basically saying, hey, I need some help, and it's releasing chemokines. And so stem cells are preferentially, they find areas that have been damaged based on these chemokines, and then that's where they migrate to, and they start building up the new tissue structures. So one of the best things, of course, if you don't have back pain, I don't ever want you to have it. The majority of us are going to have it. And even if you don't have any back pain, it does not mean your spine's healthy. But the good news is with acupuncture and with stem cell therapy, we found those to be two of the most powerful treatments that you can do with back pain. And I've had patients who have come into my clinic and I've treated them, and they've been treated by every pain specialist, all the chiropractors, the best of the best. And even with just acupuncture, getting the needle in the right place to create better blood supply, to get more nerve communication with the brain, what we see is they'll get up off the table and say, my back hasn't felt this good in 10 years. Or And that takes longer. It takes some time, but they will feel so good. Same with stem cells. We've had patients who, we've treated them with acupuncture, and yes, we've gotten them about 50 to 60% better, but we just hit the ceiling and we can't get them to the next level. And so that's where we say, well, it's time to get some regeneration. And so that's where we bring in the stem cell therapy, because what stem cells do is they go in and they will, as you could see before, they turn off the inflammatory process. They help promote better blood circulation in the area, so you'll get new blood vessel growth. And then once you have that, then all the tissues, the surrounding structures that support the back, can actually help rehydrate the discs so that you have some cushioning in your back, so it's not constant trauma on your back every step you're taking. And then once you have the better cushioning, then those nerves are going to flow better. So you're not going to have the amount of pain that you've had, and the muscles won't go into spasm, and your back will feel so much better, because back pain can truly be one of the most debilitating things. Actually, back pain is the #1 cause of disability worldwide. And it's epidemic in everywhere we are, because we're not moving our bodies in the right way. We're eating foods that cause inflammation. We're not staying hydrated. And then we're not giving our back the proper breaks. We're not getting the proper hydration by doing some inversions or hanging. So give your back some love today, and know that there are treatments out there that can help get you to the next level. Hope this has been helpful. As you guys know, we do this every Wednesday, and we appreciate many of you have been on this webinar series with us week after week. So we really love you and appreciate you being on this. Share this with your friends, anyone who you think could use some support. Let them know about this webinar. So, Kate, any announcements or things you want to say?
No, we just really appreciate everybody being on. That was awesome stuff. Thanks, Reagan.
My pleasure.
We will see you all next week. And let's see, do I have the topic up for next week? So next week we are going to be talking about, let's see, stopping dieting. So,
oh, yes. Okay.
Yeah, so stop dieting and start looking at lifestyle changes and different food groups, and looking at diet a little bit differently. So tune in next week. We look forward to seeing you guys.
Take care, everybody. Bye-bye.
Bye-bye.